Treatment of fibroadenoma actually depends on the patient's needs, depends on the concerns of the patients, also depends on just the expectations of the patient, sometimes their parents, what they expect, what are their outcomes. Mostly what we do with patients with fibroadenomas, we use to monitor them. We use to monitor them through breast exams. We use to monitor them through clinical breast exam with the healthcare provider. Another way to monitor a fibroadenoma is kind of what we talked about earlier through the ultrasound. So we can actually monitor them and kind of tell whether or not they're progressing, meaning whether they're changing in size or not. It's through the ultrasound as well. And that's usually determined by the radiologist. So that is one of the ways. You can use an ultrasound guided core biopsy. With the ultrasound guided core biopsy, this is actually recommended. And this is recommended to rule out any other type of breast disease that could be going on. So with this core biopsy, you go in, you take a sample of the tissue. We send it off to pathology just to find out exactly what this tissue is. And with that, treatment is determined from there, whether or not we want to sit and watch and wait. It just depends on what pathology shows. So then if we have somebody that says, you know what, no, I do not want to watch and wait, then we go to the next level. Or if we have someone that says, you know what, I want to watch and wait, and you come back in 6 months and this tumor or this lump has grown more than at least 2 centimeters, then we actually recommend this coming out. And that is what we call a lumpectomy. So that is surgical removal of this fibroadenoma. So we will take the patient to the OR under anesthesia and actually move the lump from the breast. And normally we don't try to do that unless the fibroadenoma is growing. Other than that, we will leave it in place. And these are just some of the treatments of fibroadenomas. However, there's actually a new treatment on the market now, and it's actually a fairly new procedure. And with this procedure, what happens is it's called cryoablation. And with the cryoablation, what we do is actually use extremely cold liquid nitrogen. And this liquid nitrogen is actually used to destroy the benign is non-cancerous tumor cells of the breast. And this can actually be done in an outpatient setting where the patient doesn't have to go in the OR and be in the anesthesia. So this is something new that's new on the market now.